7 unusual signs of a stroke you should know about. Did you know that cerebrovascular accident, also known as CVA, is one of the leading causes of death and disability worldwide? But what makes a stroke so dangerous are not only the common signs we know about, but also those that are less known and often ignored. Today, we're going to reveal 7 unusual signs of a stroke that can save lives if recognized in time. Before we move to our list, let's understand what a stroke is. A stroke happens when blood flow to a part of the brain is interrupted, either by a blockage, known as an ischemic stroke, or by a leak or rupture of a blood vessel, known as a hemorrhagic stroke. This can cause brain damage, loss of function, and, in severe cases, can be fatal. Stroke is a leading cause of death and long-term disability in the United States. The stroke death rate increased from 38.8 per 100,000 occurrences in 2020 to 41.1 per 100,000 in 2021. Additionally, stroke does not discriminate by age. Anyone who thinks that only elderly people are at risk of being affected by a stroke is mistaken. Data from CDC in 2014 showed that 38% of people hospitalized for stroke were under the age of 65. It is vital to recognize the warning signs and symptoms of a stroke, as quick emergency treatment can mean the difference between recovery and long-term disability. It's really important to be aware of symptoms. For instance, in one survey, while 93% of participants knew that sudden numbness on one side of the body could indicate a stroke, only 38% were familiar with all the major symptoms and understood the importance of calling 911 during a stroke. Do you know the signs of a stroke? Stay with us until the end of this video, subscribe to our channel, and gain access to the best health content on YouTube. Without further delay, let's get to the list. Number 1, sudden vision loss or double vision. While many know sudden weakness as a sign of a stroke, loss of vision in one or both eyes can also be a warning sign. This can happen so subtly that it is often ignored. Vision loss can occur suddenly and without warning, representing a medical emergency. This happens when blood flow to the areas of the brain responsible for vision is interrupted or reduced, depriving brain tissue of oxygen and nutrients. In addition to total or partial vision loss, some people may experience double vision, a condition known as diplopia, where a person sees 2 images of a single object. These vision symptoms may be accompanied by other signs of stroke, such as weakness on one side of the body or difficulty speaking. 2. Vertigo and loss of balance. Vertigo and loss of balance or coordination are also lesser-known signs of a stroke that can occur suddenly. Vertigo, a form of dizziness where a person feels as if the environment around them is spinning, can be especially alarming when there is no obvious cause. Loss of balance or coordination can cause a person to stumble, have difficulty walking, or be unable to stand, potentially indicating a stroke that affects the parts of the brain responsible for movement and spatial orientation. These symptoms can be confused with other medical conditions, such as labyrinthitis, but when accompanied by other signs of stroke, they represent a medical emergency that requires immediate attention. 3. Sudden confusion. Sudden confusion, characterized by unexpected difficulty, understanding what is happening around you or expressing yourself clearly, is an important sign of a possible stroke. This symptom can manifest itself as disorientation, problems following conversations, difficulty formulating words, or understanding other people's speech. Stroke affects the brain in ways that can temporarily or permanently disrupt cognitive abilities and communication, depending on the area of the brain affected and the severity of the damage. When blood flow to areas of the brain responsible for language and cognitive processing is disrupted, individuals can experience aphasia, a condition that affects the ability to communicate. Aphasia can vary in severity, from difficulty finding the right words to a complete inability to speak or understand spoken language. This stroke symptom is particularly alarming because it can appear suddenly and without warning, often without being accompanied by pain or any sensation that indicates a serious health problem. 4. Severe headache with no identified cause. A sudden severe headache with no known cause may be indicative of a stroke, especially in cases of hemorrhagic stroke where bleeding occurs within the brain. This type of headache can be described as the worst of the person's life, often accompanied by other symptoms such as nausea, vomiting, sensitivity to light, or changes in consciousness. Unlike common headaches, such as migraines or tension headaches, the headache associated with a stroke comes on suddenly and can intensify quickly. The mechanism behind the severe headache in a hemorrhagic stroke involves increased pressure inside the skull due to bleeding, which can irritate the meninges, the membranes lining the brain, or other brain tissues. This pressure can lead to intense pain and, in some cases, loss of consciousness. It is very important to be able to recognize that a sudden onset and extremely intense headache requires immediate medical evaluation, as early treatment of the stroke can make a significant difference in the long-term results for the patient. Liking our video so far? Before we move on to the next stroke sign, don't forget to like, subscribe to the channel, and turn on notifications to be the first to know when we upload new exclusive videos. 5. Sudden nausea or vomiting. Nausea or vomiting that comes on suddenly can be an unusual but significant sign of a stroke, especially when there is no other obvious explanation, such as a viral illness or food poisoning. This symptom can be particularly common in cases of hemorrhagic stroke, where bleeding in the brain can increase intracranial pressure, causing discomfort and vomiting. What causes this symptom is the direct effect of pressure or damage to areas of the brain that regulate vomiting and nausea. 6. Sensitivity to light. Increased sensitivity to light, or photophobia, is not a symptom commonly associated with stroke, but it can occur in certain cases. This symptom may be the result of increased pressure in the brain or bleeding in areas close to the nerves that regulate visual perception. Photophobia can be so severe that normal or sunlight light can appear excessively bright, causing significant discomfort or the need to avoid bright environments. Although photophobia can have a variety of causes, when accompanied by other signs of stroke, it is a strong indication that urgent medical evaluation is necessary. 7. Change in speech pattern. Changes in speech, including slurred speech, difficulty choosing words, or speaking incoherently, are the most recognized signs of stroke, but their presentation can vary significantly. These changes may indicate a stroke that is affecting areas of the brain responsible for language and communication. Changes in speech patterns can range from mild to severe and can be one of the first signs of a stroke, especially in cases where other causes, such as intoxication or hypoglycemia, can be excluded. Quickly identifying these changes and seeking immediate medical treatment can improve long-term speech and language recovery. Now that you're familiar with the signs, it's important to understand the risk factors, such as hypertension, diabetes, smoking, obesity, family history, and physical inactivity. Recognizing and managing these factors can greatly reduce your risk of stroke. Prevention starts with lifestyle changes. It is important to change habits, a balanced diet, regular exercise, control blood pressure and cholesterol, and avoid smoking. Smoking is the cause of many diseases, so stay away from cigarettes. Keeping a healthy weight and keeping an eye on any pre-existing conditions are vital steps in prevention too. When a stroke happens, it's crucial to act quickly. The treatment varies depending on the stroke type and may include medications to dissolve clots or surgery to fix damaged blood vessels. Rehabilitation plays a vital role in helping the patient lead a full life, aiming to restore function and prevent future strokes. Knowing these unusual signs of a stroke can be the difference between recovery and serious consequences. If you or someone close to you experiences any of these symptoms, seek medical help immediately. Your quick action could save a life. If you found this video helpful, please consider giving it a like and sharing it with your friends and family to help spread potentially life-saving information. Don't forget to subscribe to our channel and click the notification bell for more vital health information. Thank you for watching. Until the next one.